Are you hesitant to see a chiropractor because you have osteoporosis, arthritis, disc bulges or herniations, or because you've had previous spinal surgery? Or do you just not like having your neck or back twisted, cracked, snapped, or popped?
Hi, my name is Dr. Brian Smith, and I'm a chiropractic physician. Maybe you'd like to be able to turn your head better while you're driving. Maybe you'd like to be able to reach up and grab something off a shelf without pain in your shoulder. Or you'd like to be able to read without getting headaches. Perhaps you'd like to be able to bend over and pick things up, work in the garden, or improve your golf game, but you just can't because your back pain is limiting you. It could be that you'd like to be able to sleep better, or work on the computer without your hands hurting. Maybe you'd like to be less irritable and enjoy your time with your family more, but you just can't because you're in pain. However, you might not feel that chiropractic care, which routinely addresses these problems and more, is right for you because you have osteoarthritis, osteoporosis, herniated discs, or even have had spinal surgery. Maybe your medical doctor has told you that you can't see a chiropractor because of your condition. Or maybe you just can't stand the thought of having someone twisting, turning, cracking, or popping your neck and back. I don't blame you for these thoughts. In some instances, you might be right. There are times when more physical, aggressive chiropractic techniques are not appropriate for the people with these conditions. But I've safely and effectively treated people with these conditions for years. There are solutions to your problems, even if you've thought that traditional chiropractic care might not be right for you. I've been in practice since 1990, and I've treated thousands of patients with many different conditions. I have performed nearly 500,000 adjustments, and have learned how to treat people safely and effectively despite these conditions. The first piece of technology that makes our treatment safe and comfortable for those who have osteoporosis, arthritis, herniated discs, or have had spinal surgery, or even those people who just can't stand to have their spines twisted, turned, cracked, and popped, is called the ProAdjuster. The ProAdjuster is a computerized spinal analysis and treatment tool that has been cleared by the FDA. It uses piezoelectric sensors to analyze the movement and alignment of a person's spine. We then use the instrument to apply gentle taps to the patient's back to help restore proper motion and alignment to the vertebra in the spine. This technology is gentle enough that it can be used safely on even the most extremely fragile spines. I have even used it safely and effectively on people in their 90s and on young children.
We can use the ProAdjuster to analyze the spine. We can then use the ProAdjuster to treat the spine. And then we reanalyze the spine to make sure the treatment worked.
You might be wondering how something so gentle could be effective, and could it be effective for you? Well, even though it's gentle, it's effective enough to work on a 250-pound All-Pro NFL running back.
Every week, my body is banged up like you wouldn't believe, and the ProAdjuster is able to get me back in shape to the point where I feel good, my body feels good, and I figure if I feel good, then I'll play good.
Turn your head to the left.
There are even specialized treatments that we use to help loosen up the muscles in someone's neck. And the muscles in the lower back to help improve movement.
Another technological advancement that we use that helps us treat people who otherwise might not benefit from a chiropractic's care is the Erchonia low-level laser. This low-level or cold laser that we use is the first laser cleared by the FDA to reduce pain and improve range of motion. How does the laser work? Well, there's a very complicated biochemical answer to this question, but basically it initiates enhanced tissue healing and relaxes muscles. Because of the way it looks, many people think of it as a calculator that subtracts pain. Best of all, in over 2,500 studies to date, there have been absolutely no adverse side effects from using the low-level laser.
The laser can be used on just about any part of the body. We will often use it on the neck to lessen pain and help movement. Since the laser penetrates clothing, it's also easy to use on the lower back to help with pain, stiffness, and sciatica. The laser has shown to be particularly effective on shoulder problems, often helping reduce pain and increase range of motion very quickly. However, it usually takes several treatments to achieve maximum effect.
The Pro Adjuster and low-level laser are just a few of the gentle techniques we use to help our patients. We also use massage techniques, acupressure, therapeutic exercise, and brain-based therapy techniques, all of which are gentle and safe to help our patients. We can't guarantee that everyone will get results like this, but let's hear what some of the people with specific spinal conditions have to say about our treatment.
Hi, I've been coming to Dr. Bryan for quite a while. First it was my hip. I have very bad sciatic pain from botched surgery years ago. That is doing so well, it's just marvelous. Then recently I discovered my shoulder didn't want to work. So I came and doctor has been doing treatments on it and exercises, and he is my miracle worker. I mean this from the bottom of my heart. I couldn't function as a human being. It was just, my life was miserable. And now I go, another thing with my hip, I go up and down the stairs myself. This is why he is the miracle worker. I'm not trying to overdo that part, but it's the truth. And that's the way I feel. And I think that so many more of us out there could be helped if we came to Dr. Bryan.
Hi, my name is Jean Turkelson, and I'm here to try to allay some of your fears that you might have that chiropractic can be a little hazardous to you. I happen to have osteoporosis, osteopenia. My spine is deteriorating with bulging discs, so the last thing I need are heavy manual manipulations. But coming to Dr. Smith, I found that with his equipment and his approach, it's gentle, almost like getting stroked in a pleasant way. So I really urge you to get past it, come on over and try it out.
Hopefully this information will ease any fears you have about receiving chiropractic care in our office. If you already have a chiropractor who's getting good results with your conditions, by all means, please stay under their care. However, if you have concerns about your spine, please realize that you don't need to be twisted, turned, cracked, and popped to get help. I've been treating people with osteoporosis, arthritis, herniated discs, and spinal surgery for years. I'm not saying that we're going to make these conditions go away, but what I'm saying is I've helped thousands of people improve their quality of life. If we can help you with your problem, you'll be happier and enjoy your life more, and that's what life's all about. Your problems won't go away by themselves. If you don't do anything about them, they could get worse. You don't want that to happen, so pick up the phone and call my office. I don't want to waste your time or money. If I'm convinced that I can't help you, I'll let you know. There's no risk or obligation. I won't charge you anything to talk to me, and if you still don't think our approach is right for you, there's no obligation to get treated. As I've said before, I can't guarantee that the treatment we offer is right for you, but several thousand people have benefited from my care. Having less pain, moving better, sleeping better, being able to do more of what you want to do, just plain feeling better, sounds pretty good, doesn't it? It's only going to take a few minutes to talk to me and receive a screening to see if our treatment might be right for you. Isn't it worth the chance to find out if you could be helped?